Well, hi everybody. Here we are, Wednesday, February 3rd, 2021. My name's Bergen-Jackson, and this is your COVID update for the week. I feel like I'm doing a TV show after doing this for almost a year. So let's talk about vaccines. That's first on my list for today. We have been wildly successful in our vaccine clinics so far, and we have 2 more clinics coming up quick. Tomorrow's the second round of the Moderna clinic for residents who are 85 and older. And that's a relatively small clinic. Only 60 people will be at that clinic. And then next Tuesday is our second huge Pfizer clinic. So we'll have the Walgreens staff here, and we'll vaccinate about 300 people, I think, on February 9th. So I did receive a question today about the things you're seeing in the media about Tylenol and ibuprofen impacting your immune response. So first I want to say that I know it's been published by the AARP and some other very credible sources, but all of this information is just hypothetical. It isn't a result of a survey or any evidence in practice. There's just a risk, I guess, involved in pre-medicating with ibuprofen. So I called the College of Pharmacy, and I talked to some very smart pharmacists who tell me that don't pre-medicate before your vaccine with Tylenol or ibuprofen, but if you feel bad after you receive the vaccine with side effects, which are usually headache, body aches, chills, low-grade fever, if you get those side effects from your vaccine, it's fine if you want to take Tylenol or ibuprofen to relieve some of those symptoms. So that's all I know about that. So if you took ibuprofen before you received your vaccine already, I wouldn't worry about it or assume it didn't work. If you pre-medicated with Tylenol previously, don't worry about it not working. There's nothing in the evidence that says it won't work. They're just saying it could compromise your immune system. So we'll just move forward and not pre-medicate from here on out. So that's all I have to say about that. I will say that the Moderna vaccine second dose is showing more signs of side effects than the Pfizer. So we've had a lot of individuals, especially staff, who had what I would say moderate to severe body aches, headaches, chills, low-grade fever, and they just felt really crummy. We did have a number of residents feel that way too after the second Moderna last week. So I just want you to be mindful to rest, hydrate, and remember it only lasts for 24 to 48 hours. And it is a good sign that your system is receiving the vaccine and fighting it off. If you feel like you're not getting better, or you're dizzy, or you're concerned about how you're feeling, please reach out to the apartment nurse and let them know you had your second vaccine and you don't feel well. And we'll check on people. I'm not really hearing from people until they feel better, which is fine. But if you don't feel well and you want somebody to check on you, we'd be glad to do that. All of it is better than having COVID, which I'm glad to say we haven't had. So here we are in the first week of February, 11 months into this pandemic, and we have not had one positive resident in 11 months. I'm very proud of that. We did have a handful of staff who've been positive for COVID, but no serious complications, which is very good, and we'd like to continue that. So I think after the clinic next week, we can safely say that all the residents have been vaccinated and 92% of the staff have been vaccinated. I'll keep working on that 8%, and with the goal still being 100%, but 92% is very good, and we should be very proud of what we've been able to achieve with the vaccine. There's a lot in the news right now about the variants of COVID-19. There's at least 2 variants that I've seen in the news. It does look like the vaccines are going to cover the variations so far, but it's a natural part of the process of a virus to mutate. And we anticipated that that was going to happen with COVID-19. So nothing unusual is happening. I saw something in the press this morning about the AstraZeneca vaccine, which hasn't even been authorized in this country yet, working really well against one of the current variants. So I'm very hopeful that the mRNA technology in the Pfizer and Moderna vaccines will cover any variation of the virus, because they all still have that spiky protein, and that's what the mRNA vaccines are targeted for. So everything looks very optimistic. The next natural question following the vaccines is, when are we going to change everything that we're doing? And we're going to go very slowly in this process to make sure that we don't screw it up. We don't want to have anybody get sick in the 12th month of this following vaccine. So we'll start with going to the same side of the plexiglass in the Nook for visits. That we can start that right away. So same side Nook visits. We'll progress to having indoor visits again soon, not yet. We can increase the number of people dining in the dining rooms together at a table. So we'll put that out in the weekly memo as we make changes, and we'll talk about it in our videos. But we have to go slowly and be patient, because we don't want anybody to get sick. I think that's clear. You know, it's very confusing because we're not exactly sure. Can you still get COVID and not get symptoms because you've had the vaccine? Can you still transmit the virus to someone else? So we're waiting for the data to come in on that to make sure that we know scientifically what's going on. And until we really have that and greater coverage in Johnson County, there's not a lot of protection outside the walls of Oaknoll. So keep your masks on, stay socially distanced, to avoid big crowds, and we'll try to open things up safely inside the Oaknoll bubble so that we can have more of a normal life, right? That's everybody's goal. So we haven't lost sight of our goal. We just want to be careful, which has been the message all along. We've been really good about being careful. So I'm really optimistic. I'm hopeful. I'm not as worried about everybody as I was before. And that's all due to the vaccine. So keep thinking positively and keep being patient with me, and we'll get back to normal sooner rather than later. I think that's all I have right now. The Johnson County positivity is on a downward trend, which is great to see. I'm hoping that that will continue. It was 7.6% positivity on Monday, and it's been going down for about 3 weeks. So I'm glad to see that. I would hope that we would get under 5% soon. The University of Iowa and Mercy Hospital are going to start vaccination clinics for people over the age of 65 in the general population, and public health has advanced us to phase 1B, which opens up the vaccinations for more people in the community. And I think as we go along, there'll be more availability of the vaccine for everybody to get vaccinated. So things are looking up here in Iowa City. Please, as always, let me know if you have any questions. Send me an email. I'll get back to you as soon as I can, and I'll see you in 2 weeks. Thanks.